Thank you. Good afternoon, everyone, and welcome to this afternoon's, second to last brown bag presentation of this academic year. Thank you all for being here, and for those of you who continually support the brown bag series, whether you're able to be present or watching the recordings after the fact, all of the support matters a lot to the continuation of the series, and we really appreciate it. So Dr. Orhan Erdem is an associate professor of finance at Curry School of Business at Rockford University. Previously, he worked as the head of the research department at Borsa in Istanbul, at the Istanbul Stock Exchange. He has more than 10 years of experience in academia and taught at several universities on 3 continents, like Texas A&M University in Commerce, the University of Texas at Dallas, Bilgi University, and Universidad Europa de Madrid. He earned his PhD degree in economics from the Universitat Autònoma de Barcelona in 2008. He has 3 books published. His latest book, After the Crash, analyzes the ongoing effects of the 2008 Great Recession. Please join me in welcoming Dr. Erdem today.
Thank you, Marilyn, and thank you, everyone, for joining this presentation. So this is another crisis after 2008 crisis. Well, this research is basically a trilateral research. I informally call it children, vaccines, and carrots. So the children parts belongs to Professor Kelly Monson here. So he is here. He's a professor, assistant professor of education. And vaccines part belongs to Şükran Erdem, my wife. She's a medical doctor. And the carrot parts belongs to me. So I refer to incentives by saying carrots. So we entered the 3rd year into the pandemic, and then still it's not over yet. And the global death toll has surpassed 6 million people. And we are still not done yet, but at least we have publicly available vaccines. So as of now, at least, it seems partially over, but not exactly over, thanks to the vaccines. So I'm going to show you the vaccination rate in different countries, including United States, and start the discussion. And the discussion is basically about how the vaccination is changing in a specific region, which is Rockford. So this is the share of vaccinated people against COVID-19 as of yesterday, by the way. Do you see my screen, like the graphs on your screen?
Yes.
Yep.
Okay. Because I have my iPad with me, I can see the graphs there. Okay, so if you see the vaccines on your screen, I'm sorry, the graph on your screen, you see that the vaccination rate in United States as of yesterday is 77% still, as of now. And then I'm going to show you something even more interesting. So to the right, it's the cumulative vaccination rate between the countries, among the countries, different countries. And United States is not among the best, at least. So this is United States. So as you can see from this graph, even though in the beginning of 2020, everybody was rushing to get vaccinated, now the initial excitement has faded away. We kind of reached to a plateau. And when I was getting my first shot, I needed to take an appointment. We just get into turn, like there was a line, there was soldiers helping us. We waited a couple of minutes, not too much, but it was so much crowded. And the second vaccine was a little less crowded. And my 3rd vaccine was totally coincidence. I took my son to get vaccinated, and they asked me, hey, since you are here, would you like to get your 3rd vaccine? I said, yes. So no appointment, no nothing. It was totally coincidence. There was almost nobody there. So it was not even a crowd. Anyway, so the vaccination rate, this is the vaccination rate in the United States. As I said, the initial excitement has faded away. Even worse, there is vaccine hesitancy is higher among the younger people. So the question is currently how to boost the demand for vaccines in the United States, at least, or among the world. So there are various vaccine incentives or mechanisms proposed. So these are the 5 that I found in the United States. The first one is cash incentives. So these are the cash incentives, but these cash incentives are generally experimental. So they just like I ask 100 people, and then they make an experiment between control and treatment group in a totally unnatural environment. It's a laboratory environment. The second one is basically lotteries. I think Ohio tried this, Illinois tried this, and a couple of states are also have been trying it. So they are offering a lottery to get vaccinated. The third one is government mandates. This is mostly this has been mostly tried in Europe. So some institutions are not open to public if you don't show your vaccination card. The fourth one is nudges. They kind of try to nudge people by offering I don't know, beers or whatever, those kind of easy things. And the last and the topic of this presentation is real cash in a real environment. So this is different than the very first one. Very first one is just like experimental cash, but this is real cash that are being offered. So this is what Rockford Public District has been still trying. I'm going to give more information about that. But these are the 5 main vaccines that are being implemented in United States. So this is the literature, and I'm not going to just talk all of them one by one, but just to give you a rough opinion, the cash experiment performed among people, like they offered $10 or $50 financial incentives to a couple of people and then try to see what's going on. The vaccination rates increased. And the second one is the lottery. So as I said, so this is the lotteries. Most of the lottery papers are the papers who are analyzing the lotteries. They show that the vaccination rate increased. So vaccination rate, the most common one is the lotteries. Nudges, again, they show the vaccination rates are increasing. Again, just please pay attention here. This is somewhere around 1%, 1.5%. Like I'm talking about averages. Vaccine mandates are the most powerful ones, or just government is saying that you can't get into that institution or you can't get your X and Y license unless you show us your vaccine card. So this is mostly done in Germany, France, and Canada. Please pay attention to the ratios. It's at least somewhere around 6, 7, or 8 percentage points increase in the vaccination rates. And there are also ethical discussions. Some people are saying that if you pay people, this is not ethical just because people would think, or other way around, it gives a diverse effect. If you pay people, they will think that there should be something wrong with the vaccines. That's why people are paying. Anyways, there's a huge discussion going on, but what I did here in this slide that we are seeing that there are 5 main incentives that are being trying to boost the vaccination rate. So the question in this paper is, in the next slide, is this. On August 13, 2021, the Rockford Public Schools in Winnebago County, they announced that students who are between 12 and 18 would be paid $50 in gift cards for receiving the COVID-19 vaccines. By the way, full disclosure, I get this money. I have 2 kids and 2 vaccinations both, so I received $200. This is for disclosure only. So the question is, was this effective compared to the ones that I showed you, like nudges, cash experiments, government vaccine, government mandates, and lotteries? By the way, we had a lottery in Illinois too, but this is on top of it. And there are 2 things that are worth here. The first one is this has not been done in different counties in Winnebago, which I will show in a moment. And this is among the young people. So no adults are included here. It's between 12 and 18. So you have to be a high school student. So that's why this is like a little different than the previous literature I showed you. So Winnebago County, this is the map. Winnebago County is here. Do you see the map on your screen? Okay. Somehow yes. My other screen is lagging. Okay, there is Winnebago County here. So there are 4 main counties neighboring: Boone, DeKalb, Ogle, and Stephenson. And we didn't take a look at Wisconsin, which is to the north, just because the demographic is totally different. There is no lottery there. There is a lottery in Illinois. So this political environment is totally different. That's why we are interested in the following question, which I'm going to give in a moment. So this is a perfect setting. Initially, when I get this email from Rockford School Districts, I thought that this would be a great question, but I waited a couple of months just to make sure that nobody around us receives the same exact incentive so that we can make a control and treatment experiment. And then luckily, the perfect setting happened. So no other neighboring countries around Winnebago received a similar incentive. So it's $50 cash per dose. And Winnebago population is 400-something a year. So this is the public school districts in Winnebago. This is Kelly's part. Thank you, Kelly. So Winnebago is, Rockford Public Schools is 63% of Winnebago, meaning that the remaining 37% did not receive any incentive in Winnebago too, just to show all the details of the setting. So this is a total natural experiment. We didn't do anything. We followed what's going on and then try to see if that incentive was effective or not. So Rockford Public Schools is 63% of Winnebago. Other school districts in Winnebago did not adopt any similar incentive of cash. So all of the school districts you see here did not receive. So only Winnebago and only Rockford Public Schools. So again, let me reiterate the question. So the question here is, Rockford Public Schools adopted a gift card incentive for the kids who get vaccinated, $50 per dose. Now, the research question here is, was this effective? And if yes, how much? So they spent, I forgot, I will give the number at the end of the presentation. So there's some money, some public money spent here. So was this worth or not? So that's the question of this research. So this is vaccination rates. There's too much information here, but just please pay attention to the information in the square bracket here, in the red square, not red rectangle, I'm sorry. So these are the vaccination rates aged 12-17 between July and August. It's before the incentive. So please pay attention to Winnebago. It was somewhere around 34% before the incentive. And only Stephenson was below Winnebago. So the highest one was DeKalb, and then Boone, and then Ogle, and then Winnebago and Stephenson. So it's fourth among five. And then after the incentive, it is third among the five. So it's increased a little. It surpassed, the vaccination rates in Winnebago is now higher than Ogle County. Just some descriptive statistics, what's going on. The rest is not too much of importance as of now, at least. Okay, I think this is the most important slide and most important picture of the presentation. So the red line is the vaccination rates in Winnebago, and the blue line as a set of all neighboring countries together. As you can see, even in the first slide, something is very obvious that there's a kind of real jump there after a couple of days, maybe even a week after the gift card announcement. So the vertical dashed line is showing the gift card announcement date, 13th of August, 2021. It took a couple of days, and then the vaccination rate jumped by some percentage. And the question is, what percentage, and is it worth? Okay, so how can we measure that jump? That's the question. I'm not going to go into the details of that methodology, but it's something called synthetic control approach. I will just give you the idea. This is very new approach in social sciences. And in a paper, two scholars, Athy and Imbens, they call this the synthetic control is arguably the most important innovation in the policy evaluation literature in the last 15 years. It's very new. The idea is this. Let me show the graph once again. So the red line is Winnebago County, and there are two dashed lines here. This is the methodology that I use. The idea of the methodology is this. We try to build a relationship between Winnebago and neighboring countries before the event. And then it's a mathematical relationship between Winnebago and other countries before the event. Once we discover that relationship, we are kind of assuming that that relationship should be continuing here. So that dashed line, you see there are two dashed lines here. One is green, one is yellow. It's kind of the counterfactual line. meaning that these dashed lines would be the vaccination rate in Winnebago had there been no vaccination incentives. So that's the idea of synthetic control. I'm not going to give more details about that, but that's the whole idea. First, you build the relationship before the event. And then using that methodology, you are assuming that that relationship should continue after the event too. And that gives us these two dashed lines, green dashed line and yellow dashed line. In other words, this is the second most important graph of this presentation. In other words, if there were no vaccination incentives, those two dashed lines would be the Winnebago vaccination rates. And that's why the difference between those two lines, maybe I should use a different color. Let's use blue one. So this area here is the increase in vaccination rates in Winnebago. That's the idea of this research. Okay, so in fact, I am done. I'm going to give the results in a moment, but let's make a couple of robustness check. Is it still, maybe, is it a coincidence, or if we change the name of the country, if we change the dates, if we change a couple of stuff, kind of placebo tests, would this happen again or not? Or that's the question of the rest. In fact, this is the result that we found as of now. Okay, the robustness check you see on your screen, we decreased the number of countries from 4 to 3, and then from 3 to 2, and then from 2 to 1. But no matter how much you change the number of countries, the event the effect does not disappear, meaning that it's still there. So this is the first kind of check. If we change the number of countries, so we decrease the number of countries each time by 1 and see if there's an effect or not, and then the effect continues. Again, we conclude that there should be an increase. Even though this graph looks ugly, what we did here is change the treatment country. Instead of Winnebago, what if I change the whole analysis to DeKalb, and then whole analysis to Boone County, and then whole analysis to Ogle and Stephenson? Would I conclude that there is an effect for Stephenson, or would I conclude that there's an effect for Ogle or DeKalb? And this is kind of the yellow bars below, like panel A. If I call the upper panel A and the lower is panel B, in the lower panel, the effect of Winnebago is by far the highest or the biggest. So none of the other countries just approaching the Winnebago. If I change the control, so there's a treatment country, Winnebago, and there are 4 control countries. So if I change the treatment country from Winnebago to Ogle, the effect disappears, and then the DeKalb disappears. So the highest effect belongs to Winnebago. So changing the name of the treatment country does not change the results of our research. The other one is, what if we change the treatment date? So remember, the treatment date was August 13, 2021. Now I shifted it by 1 month. So August 13 is here. So this is August 13. Now I shifted by 1 month so that the new research does not even cover anything from my previous research. Maybe I forgot something here, by the way. Go back to our analysis. So this analysis here starts 1 month before the gift card announcement and lasts 5 weeks after the announcement, which is very common in synthetic control analysis. So 4 months before the effect, 4 weeks before the effect, 5 weeks after the effect. It's totally 9 months. So in the placebo tests, we change the treatment date. Instead of August 13, now we are assuming that it is June 4th. And as you can see, the green line is Winnebago. There is no effect at all. So it doesn't even just goes down. And then look at the effect. This is called root mean square errors, but the name is not important. Just to give the illustration. Remember, in the previous graph, the effect of Winnebago was somewhere around 20, and these, none of those are close. There's no even 10 here. So changing the treatment date does not change the results. Winnebago has an effect. So what is the conclusion of this research after too much information? The conclusion is this. We adopted 2 methodologies. The first one is linear regression, the yellow dashed line. And the second one is synthetic control, which is a fairly new one, which is the green dashed line. They both showed the vaccination rates increased by 2.6, between 2.6 and 2.7% respectively, 2.6 linear regression, 2.7 synthetic control. In other words, had gift cards not been offered, the current vaccination rates in Winnebago would be somewhere 2.6 and 2.7% lower than what we have right now. These results, as I showed you the literature in the beginning of the presentation, are consistent and very close to the increase caused by Ohio's lottery. So Ohio lottery, it's not very close, but it's even higher. So most of the research, they conclude that offering, I think they offered $2 or $3 million. It increased the vaccination rate by 0.7 percentage points. And then another research shows that it increased by 1.75 percentage point in Ohio. But the Winnebago vaccination rate, just offering money to young adults, $50 per dose, increased 2.6%. By the way, I sent an email to Rockford Public Districts, and we sent an email and asked the total amount of the cost. And I divided the total amount of this incentive by number of students. It's $11 per student. These are the other research are somewhere around $75 or $60 per person, meaning that apart from the government mandates, which is the highest, so offering cash incentives to people, at least to young adults, gives the second highest vaccination boost among other incentives. This is the bottom line of the research. I am basically done. I can get questions if there's any.
Thank you, Orhan. That was fascinating. I'm like crunching numbers over here. So
too much numbers, but this is basically the result. Like this jump is
that's great. Yeah, it's like it's a human nature study in a lot of ways, right? So any questions?
Katie is trying to ask, I think, but Katie, you are muted.
There we go. I got myself unmuted. Okay, so I have a question. So did it jump you're saying for the county-wide, this isn't Rockford Public Schools numbers that jumped, it's county-wide that what we saw the jump.
It's a great question. Yes, that was the thing. Normally the incentive is offered only Rockford Public Schools, but right. This jump is in Winnebago. Okay. So in fact, there's a couple of calculations there, but like we kind of adjusted numbers to 2.6, assuming that the other 37%, remember, the other 37% in Winnebago was not offered any public incentive. Even that much amount increased the vaccination rate, like 63% of the people are incentives. But 2.6%, which is our conclusion, our result, is in the whole Winnebago. Thank you, Kate. Well, some might think that what is the validity of this question for the whole United States, or is it something regional, or can we, I don't know, extrapolate numbers to other districts? I think yes, this is a great experiment, natural experiment performed in our neighborhood in Rockford. I think every single county in United States or every single country in the world, depending on their budget, they can adopt a similar strategy depending on our results. I mean, if they're asking something more, government mandate is the easiest one, costless. There's no cost there. You say like you have to bring your vaccine card, boom, you're done. This is a little costly, but it increases the numbers too. So as you may remember from the literature, only European countries they could offer this government mandate because of the probably political environment. It's a huge discussion. Can we offer like a government mandate or what?
I have a question about this slide. Actually, your last category there, ethical issue. What are the ethical concerns, and did you see any evidence of parents, for example, reacting with respect to the ethical aspect of offering cash incentives?
Well, this is in fact a quantitative analysis. I don't know what's going on with the parents. There should be, by the way, and I hear that it's yes, but I personally did not encounter anything. But it's part of the discussion. I mean, even the government mandates, people are saying that this is not legal, this is not democratic, at least this is not freedom. So there's a huge discussion going on with the ethical issue. But again, I think I should reiterate this. This is the limitation of these issues. I did not question that one. I just, when I say it's wrong, I'm sorry. We only took a look at the result or the consequence of the payment. So the ethical issue is kind of out of this question, our question at least. But there's a huge ethical issue going on there too. Did I answer at least partially, Marilyn?
Yeah. My thought is that sorry, my dog is on the move. He's right here. So, sorry, buddy, give me a second. So so my question, it had to do with, the government mandate is very different than offering a cash incentive because it offers every individual the choice, right?
Mm-hmm. Right.
So what would the ethical concern be with regard to offering it if maybe the parental response wasn't a concern there, or did children themselves have
it's
an
a
issue
political
with it?
choice. Maybe that's the issue.
Yeah.
People are saying that, hey, you can't spend my tax payments to vaccines. You should, I don't know, build roads or whatever. This is one issue. The other issue is the adverse effects. Some people are saying that if you pay, people would think that this would cause there's something wrong with the vaccines. So it will decrease the vaccination rate. So you should not do it. So there's a huge discussion going on there. But again, this is beyond the limitations of this research. We didn't even pay attention to that. We just, our question is very, very simple. So what is the effect of $50? So that's the question. But maybe, I don't know, conducting a survey and asking the parents might be a secondary study, Kelly.
Social media allows us to see what the social response to that is. It was quite wild and crazy when that first initially came out. There was quite a lot of talk on social media, at least that I saw. I don't have kids in that district, but my other question was, what is and maybe you showed it in a slide and I missed it. What was the jump for the Rockford Public Schools student population? Did you show that?
Oh, jump in the vaccination rates, you mean?
Yeah, like prior to school starting, was it at like 20% of the students? And then after the incentive was given, it went up to 25 or 30 or 40 or? I know you did.
Yeah, is this your question? So before the incentive, the average was 34%, and then it jumped to 43% between the ages of 12 and.
Oh, okay, I guess I see. Yeah. But I'm just curious what Rockford Public Schools actual numbers might have been, but.
Oh.
Like what was that jump? Did you have that specifically at all?
No.
Oh.
In fact, I mean, that's a good question. So the vaccination rate we got from CDC, and the CDC only announces the vaccination rates in Winnebago. So there are two different data here. The vaccination rates comes from Winnebago. That's why we are restricted Winnebago. We couldn't kind of confine the data into RPS. That's why we had to make a couple of adjustments. And then, so we kind of assume that if our school districts increase this much, what would have happened if the incentive would be offered in 37% of Winnebago too? So there's an adjustment with the data too. But yes, they don't announce the vaccination rates in Rockford, or neither Rockford Public Schools nor Rockford. So it's county based.
Right. I didn't know if you asked Rockford Public Schools in your research if you spoke with them.
Oh, that's a good question. Yeah, maybe we should note that.
And they know their rates. I'm in a school district. We know our rates. And we know how many have it. And
Kelly, did we do something like that? Like, did we ask RPS if they know?
Yep, we did. We were in conversation, and we can, through FOIA, we can ask for full rates. Obviously, due to confidentiality, we were, careful with our questioning. At the time of our research, they didn't have a completed count, which is why we went with the county numbers. But that would be a really great follow-up. What happened is in the initial push out, and maybe Katie, you have a deeper perspective to this, but the district response is in the initial rollout, they tracked and then they pushed it into the schools for internal tracking for the amount of students that were receiving the incentive school-based. And so that information hadn't come back to a central location during our research. So maybe at this time we could do a recall to see if now that the incentive period has passed, if there is kind of total numbers for Rockford Public Schools, but we did not have access to that information.
Yeah, it would have been probably very great to communicate with Winnebago Health Department to maybe they might give us some more information about what's going on. But these are mostly the data we retrieve from CDC's webpage and from Rockford Public Schools, what they did, what kind of incentive they give, when did they announce it exactly. Yeah.
I have a question. Thank you, Orhan. I really enjoyed the presentation. I'm afraid, though, that I had not heard anything about these incentives for students.
Really, Rockford?
Well, we live in the county, but we live in Roscoe.
Oh, okay.
So, and I thought I watched the news enough so that I know what's going on, but I totally missed this. Did the funding for this come from federal money? Just out of curiosity. I wondered how the school district paid for it. They didn't tell you that?
I think actually, hang on one second. I think they did actually reference where the funding came from. Let me see if I can surface that.
I'm just curious.
I don't know. I don't know, Mary. Probably Kelly would know better. She's in the RPS part. I'm mainly concerned with the money. So what does money do? So that's the question.
I'm curious too, Orhan. Did they track demographic differences? Did they notice that after the incentive, more of a certain demographic got the vaccine more than others? Do you know that?
Well, to the best of my understanding from the communications with the RPS is they did not collect the data very efficiently. At least what I observed is too. So when I went to my son's school, I said that we got vaccination, they put a tick there and then they gave me the gift cards. So if it's a kind of paper sheet, maybe if they document it to some Excel sheet and then kind of match it with the previous data, if we are white or black or I don't know, from minorities, whatever, they might make sense. But as of the date we are conducting this research, we did not and we couldn't get more information. And that's a probably great question. And yeah, there's another discussion going on with the minorities. That it's commonly concluded that minorities, Blacks, Latinos, they are less vaccinated than the other people. But we couldn't retrieve any data from Rockford school districts.
Yeah. Huh. And do you happen to know? I'm not expecting that you do, but how did they come up with $50?
Oh, I don't know. That's a very interesting question. $50 per dose.
Yeah, I wonder.
I don't know.
Because I would think that
even the experiments, like you remember my very first slide, let me show that. Even the experiments was somehow done with $10 and $50. So it's a kind of probably.
Yeah. I'm just curious if some people would be like, yeah, for $50, but no for 10. Like, you know, if. Yeah,
I'm pretty sure that it has an effect. If it is $100, imagine I would have received $400 instead of $200. So I have two kids with two vaccines. So I don't know. I mean, it's an interesting question. Why $50?
That would be interesting. Yeah.
I see. So it was $50 per vaccine. I was thinking it was $50 for the regimen.
No,
it's 50 per. Okay.
Yeah.
You broke down
50 per dose. So if you get 2 doses, you have $100.
I was wondering how you got $200. I'm like, how did you get
two kids, 2 doses each. So.
Gotcha.
Do you think they'll give it to you for a booster?
to the best of my knowledge, it is restricted with the 2 doses.
Oh, okay.
So now I can try at least 3rd dose. Now it's 4th dose even approved. 4th dose. No, I can try to get the salary from there. More and more doses.
Did
Katie,
you,
go ahead,
you
please.
said you broke down the cost that it costed $11 per student. So what was the cost then, the full cost to the district? Like,
It is, let's assume it's $10. Let's assume it's almost 20,000 people. I think it's $200,000 or $250,000 total.
wow.
I'm saying roughly. I don't. Let me check. I can check it. Just give me.
Yeah, no, that's fine.
But it should be somewhere around $200,000 because there are 222,000 students in Rockford school districts.
Mhm. Okay.
So if it is $11 each, so it makes almost 250,000. Yeah.
Wow.
It's not a great amount of money. But I don't know the source. Kelly, did you find the source?
I did. Yep. So it was a mix between the federal elementary and secondary school emergency relief fund. So they utilized those funds to pay for the incentive. So again, that was the federal elementary and secondary school emergency relief fund.
ESSER. So that's the ESSER funds, right? I'm trying to create that acronym. Okay.
It is, and it was also like there was an increase due to COVID relief. So those funds were also, kind of added into that as well. So that was determined, district-wide, but they also received federal funds for COVID relief.
And the incentive was in place for 6 weeks?
No, it's still continuing, by the way.
Oh, it's
This
still continuing.
research, we somehow, okay, so this is the graph. It started on August 13, but we stopped after 5 weeks to see if it has an effect. But the graph is more or less the same. Yeah, it's still on. I mean, if you bring your vaccine, I mean, the card, they would still pay you.
Oh.
But that vaccination rate is already jumped, so it won't go down. So that but the initial question is what happened here.
Right.
The main question is what happened here. And I don't know other districts, other countries, the United States applying a similar methodology. So that's why it's kind of sounded very interesting to me. I'm pretty sure that there should be some, but at the time of this research, there were no like monetary incentives around, at least to the best of my knowledge. So that's why it's a kind of little interesting. There are lotteries around. There were a couple of beers, those kind of things, hamburgers. People are offering different things, but the effect of money on vaccination rate as a natural experiment was not done.
And we did confirm that the other schools in Winnebago County and the surrounding counties did not offer any type of incentive. So we were able to confirm that information. In fact, I think, Katie, you asked this question. This was the full kind of comment or quote that went out to the public, is that the federal government is encouraging school districts across the county to use federal money to create incentives to boost the number of vaccinated students. We're setting aside some of the federal elementary and secondary school emergency relief fund, emergency COVID-19 relief money to prioritize safety in a creative way. So that's what kind of went out in their publication.
Thank you.
So when you look at this this chart, it looks like there's a jump, right, between July, 15 and whatever. But now it levels out. Do you think there'll be any more jumps, or do you think that was the
Say it again, Amy. Say it again. There's the jump.
There's a jump right there, right, in your graph.
So this is the jump.
Yeah.
Okay.
But then it levels out. Do you anticipate that there's going to be another jump, or people will be used to it, and the people who wanted the money have now been vaccinated and it's gonna peter out?
No, I mean, I checked the dates after that too, so there's no other jump. It's kind of, so that's why we use this synthetic control. The synthetic control is just like kind of comparing you all the time with the other neighboring countries, and there's always this 2.6% of difference between those two. I am hoping that this research, once we get it published somewhere, would be a benchmark for the other countries or other counties in the United States. So if you want to do this would be the result. So don't waste your money if you don't have this much amount of money, or if you want to increase this much, this is the result. It's kind of giving you in advance information about the results of possible results of your policy, health policy.
Yeah. For a similar sample though.
For a similar, and this is young generation, by the way, young adults. So it's between 12 and 18. No adults are beyond 18 years old are included here. And as I said in the beginning of presentation, vaccine hesitancy is higher among adults, younger adults than normal adults, like between 12 and 18. I think they call it vaccine hesitancy. Vaccine hesitancy is 16% among young adults who don't want to get vaccinated. And it's 11% among normal adults, like 18%, 18 and plus, 18 years old and young, older. It's much more high. I don't know why. I mean, young people are more hesitant than the old people. I would expect the other way around, by the way.
Me too.
Well,
But
I think that some of at least the middle school kids that I've talked to are like, yeah, we don't get affected by it. What's the point of getting the vaccine?
yeah.
We barely have symptoms, we'll get rid of it in a couple of days, that kind of thinking.
Yeah.
And if that's, if that runs rampant, then the vaccine doesn't seem necessary to them.
Well, I think more questions. Thank you, people.
Thank you.
Any other questions?
Nope.
My dog is officially back. he needed to go out. Ooh, yeah, he's going to make an appearance, I suspect. So thank you all very much for joining us today. Orhan, that was fascinating. It gives us a lot to think about. And I wish our policymakers would have access to this as well. Maybe that's something that's worth sharing that way.
If somebody knows some kind of authority that would be great to share this, I would appreciate if you let me know.
Former RU employee, current state representative Maurice West. You should contact him.
Oh, okay.
Yeah, and he's in towns. It represents District 67. Okay, thank you, everyone.
Thank you.
Have a great Monday.
Orhan, it's a pleasure to see you all, and we'll see you soon.
Thanks.